Good morning, Dr. Swami. How are you?
Good morning, Charity. I'm good. Thanks for having me.
Oh, thank you so much. I know that you are busy with your practice on Monday when we're launching the Lipstick Network, but I'm really, really so honored and humbled that you would take the time to speak with us. You are our expert about aging with honor, hormone health during menopause, pre, during, etc. So definitely wanted to connect with you. You're an amazing human. And so let's get started. Why don't you go ahead and introduce yourself to everyone and let everyone just fall in love with you as I have. Go ahead.
Thank you. I'm so excited for the launch. I can't wait. Um, so I'm Dr. Archana Swami. I'm a board certified endocrinologist. I do adult endocrine in Tampa. I've been in practice now for about 9 years since I graduated, and I love endocrinology. I think hormones do such a big difference in people. They're small molecules that make such a huge difference. So it's a passion of mine. And so this was such an exciting opportunity. So thanks for having me.
Oh, honored. Thank you, doctor. So you have your own practice.
Yes.
And yes, let's talk about that because Lipstick Network is all about empowering each other. So I'm just going to celebrate you a little bit.
Yeah, thank
You
you.
just launched you just launched your own practice. So tell us a little bit about that and then we'll jump right into the hormones.
Okay. So I was uh, in private practice. Then I did sort of a huge teaching hospital in the area. I worked there for a long time. And I knew this was, I knew this was going to be my end game. It gives you a lot of freedom to do what you want, practice medicine the way you want, spend as much time with patients as you want. And so I love that relationship with the patient, and I get to control my hours, my time. Uh, and so that was the goal of this practice. And you always have starting trouble when you first start. You jump off the cliff and you're like, I got to do this. So you jump off the cliff, and it's a huge ordeal. But if you are able to pivot and kind of say, okay, these are my goals, this is what I want, it does work out. It works out in the end. You got to just get on that elliptical and just keep going. It works out in the end. So I've been now in practice for a year and a half with prime endocrinology, and I am just so happy with the way things have turned out. So I can and I get to meet people like you who yes. So that is also very exciting. I love to hear stories, how you guys started, and I love to connect on that. So it's been a good ride. The first jump off the cliff, and then you'll get there. So that's kind of what I will tell people. Have faith.
I'm just so proud of you and I want to celebrate that because I know you're a mom as well and having that flexibility and I think too often women really get caught up in like the fear of things that they
Yeah.
don't take that jump. So I really appreciate your encouragement to whoever's listening if they have that dream or that little
Do
nugget
it.
just to do it. All right. Archana
Do
says
it.
it's worth it. Okay. All
Yeah.
right. Well, now,
Do
Dr. Swami, we are going to get into the
Okay.
hormones of aging with honor and with grace. I'm 38. I feel like I already got to get my mind right around what hormones do I need to be cognizant of, even like minerals or supplements that I need to as a 38-year-old woman, 8, 10 years from now going into pre-menopausal. We have women that are here in this conversation already in menopause, lots of blood loss as they're transitioning and going through. So really wanted to get an expert opinion. Just what do we need to thyroid issues? There's a lot that goes on. So could you maybe paint us a picture of at kind of an ideal journey and
Mhm.
what kind of awareness do we need to have, what kind of support would you recommend, whether that's either prescriptions or non. I have a lot of women who are taking supplements and are very into like energy healing and that kind of thing. Would you just share your expert opinion about this, please?
Okay. So I think the idea is we need to take care of our health as we go through this whole process, right? And so a good diet is a very good idea, and good exercise, good sleep habits, that's where it all kind of starts. And I know in this fast-paced life that we sometimes live, we don't do it. We take care of everybody else other than us. And so the goal here is you have to be very conscious of the time that you spend. I have two kids, run an office. It can be crazy, but we set time aside for my exercise routine. I set time aside for I'm conscious of what I'm eating. Um, and my sleep habits, because that plays a lot of role in inflammation, weight changes and things like that for women. So that's number one. And
Yep.
then the second thing I think about is good calcium and vitamin D, yogurt, cheese, milk. Those are really important things for our bone health. Okay.
Huh.
So yeah. So a multivitamin, and good calcium supplements are really, really good for bone health. So you want to do that. So those are the two things that I would prioritize. And then after that, it's individualized care. So please get your mammograms, if you're 50 or above. If there's family history of breast cancer, please talk to your doctor and say, hey, listen, I'm still 40, but there's family history of breast cancer. A lot of these things you can pay out of cash. It was one of the local hospitals ran a deal where it was like $60 to get a mammogram. So just go ahead and get it.
Oh, wow. Okay.
Right. So if there's family history of breast cancer and that's something that's running in your mind, just go ahead and get it. Get a pap smear, right? Go to your gynecologist or your family practitioner and get a pap smear. Those are things that will alleviate a lot of stress, because I like to know rather than kind of just, not know. So, right. And then come running at it when you're like, oh, I could have done this, prevent it. So those are the three big things I would say. I would say eat well, good sleep habits, exercise, 30 minutes a day, 3 times a week,
Okay. So not every day, 7 days a week for an hour and a half, like, because who got the time for
even,
that? Yeah.
30 days. Yeah. Just, whatever you like, just start very slow. Just walk around the block a little bit and then, and then just say, okay, in like a month or so, that's kind of what I advise all of my patients. Walk around the block for 30 minutes. And then in like a month or so, increase your pace and do it very slowly. And then
Cool.
calcium and vitamin D, and then do your screening.
I have a question about the calcium. Is it good, the calcium, to pair it with magnesium? I heard that calcium gets better absorbed if it's paired with magnesium.
Yes.
Break that down, doc.
Calcium, magnesium, potassium, those are all good supplements. Any of those are good. I like, if we're thinking about more my patients who are struggling with weight, what I'll say is do a protein shake, just do a meal replacement. And so that in the morning, you kind of know, this is what I'm going to eat. I don't need to worry about breakfast. I'm just going to do my protein shake and a little milk and I'm good to go. So those kinds of things help too. So just being conscious of where your calories are coming from.
Okay. Talk to me about panels that you would run, excuse me if I'm not using the correct terminology, but for women who are, in their mid to late 40s, 50s, what are some things we need to make certain that are healthy? I had a girlfriend recently was diagnosed with, like, her ferritin was impossibly low. It was a 7 out of 200 or whatever it's supposed to be. And she's now going to have an iron infusion because of ferritin. And I've literally never heard of that. So could you put some things like on our radar?
Yes.
Make sure
these
are the holistic picture, please.
Yes. So, particularly with your friends. So women, we lose blood cells when we bleed, right? So we're more prone to anemia. And so a lot of my patients will say, doc, I'm watching what I'm eating. I don't like to eat meat. I only do fish and chicken. I don't do my red meats. And so what happens is that's the source of iron. Meat is a really good source of iron. So if you're doing a diet that is primarily fish-based or primarily a vegetarian or a vegan diet, you're going to get iron deficiency. So you're going to get B12 deficiency. So that's why I kind of said, hey, you got to do your calcium and your multivitamin. And so if you're bleeding more than really heavy, going through your pads more often, you should change your pads every 2 to 3 hours. And, overnight, if you're feeling like there's lots of clots, let's just get it out there. Lots of clots,
we're lady circle. Yeah.
Mm-hmm. Yeah. If you're get a CBC, make sure you're not anemic. It takes a lot to lose your iron. So if your iron is really low, you've had this very heavy periods for a long time. And so fatigue is the primary symptom. So if you're complaining of feeling tired, get a CBC, get iron studies, get B12, get a vitamin D level. These are easy, simple tests that your primary care doctor can order, and it will kind of say, okay, these are things that I could treat if it's low. And they're simple treatments of just taking iron. Your friend probably had iron deficiency for a long time if she's starting to get iron infusions, and she kind of just let that go. And so just, it's really important to have a primary care. Get a CBC, a BMP. Thyroid is a very common cause of fatigue and weight and hair issues. So it's really simple. Get a TSH, a free T4, a total T3, get family history of whether you have thyroid disease or not. And you just get those labs and you can say yes or no. And that eases a
So
lot of
that
anxiety.
a lot of acronyms right there.
Okay.
T3 free T's. Huh?
Yeah, sorry.
You're
Sorry.
you're just an expert in these, Archana. So come on, Dr. Swami.
Yeah. I know. So TSH is a really good test. It checks what your pituitary function is. Free T4 and total T3 are good assays for peripheral hormone levels, seeing what your thyroid is producing. And so that's kind of the test that we will get. And then if there's family history of thyroid disease, we will get something called thyroid peroxidase antibodies, which look to see what your family history is and if there's autoimmune process going on that's inflaming your thyroid. So those are the three big ones. CBC, iron, ferritin are two compounds that tell us what your iron levels are and what your storage is. Vitamin B12 is straight up vitamin B12. Vitamin D, I like 25 hydroxy vitamin D. That tells me what your vitamin D levels are. That's the one that's active that we're looking at. So those are the big ones.
That's awesome. Okay. So thank you for restating that. I appreciate you. I'm like, huh? So talk to me a little bit about, I've heard a lot about testosterone supplements, and I just feel like there's always a fix to fix women as they're aging with honor. And
Yeah.
I know that there's space for those things, but I kind of wanted to get your perspective on if this is something to entertain or if this is maybe just a fad. I really want the women here to be empowered with, health opportunities and choices. Data. Yes, thank you. Evidence-based data, right? Could you talk to me a little bit about the things to maybe be cognizant of as they are making this journey through aging?
Yeah, so I will go a little bit further and first okay, so when we're thinking about menopause, ideal menopause is about age 51. Okay, so we're going to go through menopause at 51. Anybody who's under 45, who's going through menopause, let's say your cycle stop at 40, that's premature menopause, okay? And so premature menopause is a different entity. And what happens when you when you go through menopause? Your period stop. That's like, okay, my period stopped for the last 12 months, and so I'm in menopause. But what's happening to your body is that there's that FSH, LH, and estrogen axis is no longer working. So you don't ovulate anymore. The periods have completely stopped. So the hormones go through a dip. So there's no more estrogen, very little progesterone. And that is normal physiology. And, with the lack of estrogen, we have bone loss. Our risk of cardiovascular disease increases as women. So menopause is a transition time where there's increase in cardiovascular risk and decrease in bone health. And then you get the hot flashes, the vaginal dryness, the mood swings, the body weight, the brain fog, poor sleep. So these are real. These are not, I hate the phrase, oh, your cheese is hormonal. No, these are real things that are happening during menopause. So let's just make everybody on the same page. You're gaining, your metabolism is changing, your weight is going up. There is some brain fog, hot flashes, poor sleep because of the hot flashes, vaginal dryness. I will put a plug in for the NAMS Institute, which is the National Foundation for Menopause and National Menopause Society. And they are great resource, for menopause.
We'll link it. I'll make sure to link it.
Yes, please link it.
Yes.
Great resource for menopause. And there's a lot of research going on about how to treat menopause. So please follow NAMS. And so what we're trying to do is the poor sleep and the hot flashes really interferes with our cycle and our day-to-day activities. And hot flashes are seen more in my African-American women and Hispanic women, but it can be seen across all ethnicities. And so what we're trying to do is replace some of that estrogen and progesterone to sort of minimize your symptoms of hot flashes. Okay. The World Health Initiative, the Women's Health Initiative came out in 2002, and it sort of backtrack some of that hormone replacement therapy because they started talking about risk factors with estrogen progesterone therapy. And they were giving equine estrogen and a very different form of progesterone in that. And those two medications were like, oh, there's an increased risk of blood clots and breast cancer and heart disease. So no HRT to any woman. And so we turned the clock and said, and then a lot of primary care physicians, endocrinologists, gynecologists, we all said, no, okay, this study says no HRT, so no hormones. And now we've come a 20-year cycle since that study. And we've said, listen, the type of estrogen they used and the type of progesterone they used in that study is not what we're giving right now. They are FDA approved, excellent estrogen and progesterone therapies that are topical, low dose orals, micronized progesterone, which is a different way of giving progesterone without all of those side effects associated with progesterone therapy. So I think
micronized
progesterone. And so there's oral and topical estrogen and micronized progesterone, which are thought to be effective in people who are going through the transition of perimenopause, mid-menopause, and postmenopausal time periods. And we individualize treatment. So we don't say, oh, here's your treatment, bye-bye, I don't see you anymore, right? We see you regularly, we get your cholesterol, we assess your breast cancer risk, we get your mammograms, we ask you about your uterine bleeding. And so we are looking at all of those things when we give hormone replacement therapy. And so it's an individualized treatment with your doctor and you, and it does help with the hot flashes. It helps with the vaginal dryness. It helps with sleep and mood changes. And so when you're going through that transition and it is an acute precipitous drop of estrogen, it helps to slowly go through it rather than just say, okay, here's you going through menopause, right? Just
off the
slowly
cliff.
go through it. Don't jump off the cliff, walk down the cliff. It helps. And so, so that's what we're doing. And then we talk about when to taper and all of those things. Now we should ask me about testosterone. So testosterone, there's not enough data. So there's not enough data to say testosterone is something that we do give women. Okay. Testosterone is important for muscle mass and for bone health. And so there's not a blanket statement saying every woman postmenopause should get testosterone. Remember, I talked about your cardiovascular risk going up postmenopause. So there's that increased change in lipids. And so us giving testosterone might not be a good idea. Now, if you're having sexual, intimacy, issues with intimacy, so there might be a reason there to give it, but we don't blanket give it on everybody.
Okay, no, that's good.
So we always start with estrogen and progesterone. That's the big one. And then the only other point I'll tell you with the progesterone is if you still have your uterus and your ovaries, and if you still have your lady parts when you go through menopause, you need progesterone. Okay. Unopposed estrogen increase. You need
full
progesterone.
stop. You need progesterone.
You need progesterone. Unopposed estrogen causes increased risk of endometrial cancer, so you need progesterone if you still have your uterus.
Okay. Does having your lady parts as you go through this, like your uterus, ovaries, all of that, no one needs to get a hysterectomy, right? Like
no.
Nothing. No. Okay.
You don't need to. We will give you progesterone every day. And so there might be some spotting initially in the first 6 months of menopause, and you need to tell your doctor about any spotting. But if the spotting continues, then we need to go look in there. And we usually, most primary care doctors or endocrinologists work with the gynecologist, and so like you need to get your pap smears. I need to go take a look and see if you have any spotting. We'll order a transvaginal ultrasound and to go look. So yeah, so you need to just have that. Find a physician who's gonna, who's well versed in this stuff, and then 2 is willing to order the test when necessary for,
get your medical village situated.
Correct.
I think that women in their 30s and 40s, they're raising families or they're having their careers or whatever, they don't necessarily outline that village of support is the truth. So you are definitely advocating for that as we're kind of moving into a season where we're going to need some more medical hormonal support.
And talk to your girlfriends because please talk to your girlfriends because they will have a recommendation for a physician, and talk to them and just tell them, everybody goes through it. So like I just say, rip off the bandage, talk about your symptoms.
One thing I want to talk to you a little bit about are supplements. I have a
Okay.
girlfriend who's hypothyroid, right? And so she's got a hypothyroid, and I know it's hypo and hyper. Those are obviously different, but she's not wanting to use medication. Talk
Mhm.
to me a little bit about, supplements. Maybe is there a standard we need to look out for? Because there's so many, we don't regulate that in the United States, supplements. Could you talk to me a little bit about if someone is wanting to try a bit more natural or holistic process, or even just support? I think my mom did hot flashes. It was black
Oh,
ash.
black hash, yeah. So black hash, primrose, soy milk, soy products, those are all helpful for estrogen therapy. So not everybody needs estrogen and progesterone, right? Not so even low dose SSRIs, we're not using SSRIs, they're medications that sometimes you use for depression, but even low dose of that helps with the hot flashes. So when you come in and ask me about hot flashes, I'm not giving you, here's your HRT. I'm saying, hey, you want to try soy milk? You want to try primrose, you want to try some, and then you come back and then we'll do the low dose SSRI, and it doesn't work, then we can go to HRT. So it's still stepwise therapy. Same thing with boosters.
Stepwise therapy. I like
Yep.
it. Stepwise therapy. That's good.
Yep. And then same thing with vaginal dryness, right? So there are topical treatments, oils, hyaluronic acids, that's $10 at Walmart. Okay, so you can try those for vaginal dryness before you say, okay, doc, I need a cream. I need a insertion or vaginal ring. So there are options. So it is, so there are options for that. So now I guess the thyroid question. So thyroid, there are overactive and underactive thyroid disease, like you had said. And then there is, and we're looking at the levels. There is subclinical thyroid disease, which is a TSH. So if you're thinking about hypo or underactive thyroid disease, I tell people thyroid is the coffee to your body. Good thyroid gets you going. You don't want too much coffee. You want zero. You don't want any, you don't want to avoid coffee completely, right? So if you, there we go. And so, you get 3 or 4 Starbucks and you start running the day, not good. You got no Starbucks, that's not good either. You want some coffee. And so that's the way I think about thyroid disease, and it's really easy to explain to people that way. And then I say there's subclinical thyroid disease and there's like real thyroid disease that needs treatment. Okay, so if you come in and say, doc, my TSH is 10, you kind of need treatment. Your thyroid is burning out. It is a hormone that is essential and has good benefits to our body. It travels all over and affects everything. So hair and nails, everybody knows, weight and metabolism, but liver, lipids, blood sugar. And so if your TSH is 10, I will say, hey, listen, there's good data to say that you need treatment. Even a TSH above 5 that's consistent. And we're not looking as doctors just at one number. We're looking to see what did you do over time, right? And so we're looking to say, what was your TSH in 2019? What was your TSH in 2020? What did you do over time? And so that tells me a little bit about where you're trending. And so we'll say, hey, this is my treatment. So we're looking at a TSH that goes from 5, 6, 7, 10. I think treatment with thyroid medication is a good idea. Mild thyroid disease, a TSH of 3, a TSH of 4 with good normal peripheral levels, I think it's more symptomatic and we kind of individualize care there. As far as supplements for thyroid disease, the American Thyroid Association has looked at this quite often. I try to shy away from iodine drops. They can cause nodules. Nodules then can become cancer. So iodine drops make that is not something that I recommend. Selenium is something that they've looked at and might decrease inflammation. So selenium, magnesium, those are fine. I shy away from iodine drops though.
Okay. Okay.
Okay.
Anything else?
Same thing
That's
with the
actually
hyper.
okay. Okay. Anything else that we need to shy away from? Again, so much stuff out there. Anything that you would be like, hey, please talk to your doctor about this?
I think if you're there are also adrenal support supplements.
Yes, you mentioned this to me. I actually had a chiropractor whom I love give me
Yes.
adrenal
Yeah.
things from like bovine
Yes.
or something. But yeah,
Yes.
please.
I get a little nervous about those things because they are bovine adrenal support. And cortisol and thyroid are such essential hormones to fight infection, to fight inflammation, to maintain your blood pressure and your weight. You don't want to be fudging with your axis. It is so beautifully regulated. The hormones are so beautifully regulated. And I'm nervous about us fudging with them. There are people who need cortisol support, clear adrenal issues and all of that. But I don't think if you're having fatigue and somebody says, take some adrenal support, I want you to take a little pause and say, did we get blood work? Did we get CBC? Did we get iron studies? Did we get thyroid? Am I getting enough sleep? Am I eating the right things? What can I do better before we say, okay, I'm going to take
I
this
think
on.
that's good. Okay. Okay. Okay.
Okay.
For me, being able to bring these ladies today, expert, and what you just said, the axis is so beautifully, the hormones are so beautifully regular. I can just tell that you love this work and that you see through the evidence-based data how this can really support women, their families, as we're all aging and all of that.
Yes.
I want to thank you. Is there any, before we like wrap up, is there anything, parting words, wisdom of Dr. Archana Swami for the Lipstick Network today?
I absolutely love where this is going. Honestly, I am so happy our paths crossed. And I think as women, we are in a time and an era where we are unstoppable. So do what you need to do. Talk to your crew, your friends, have a good network, which is what this is all about. So I love that as well. And let's take care of us because we do a lot for everybody else. So let's take care of us.
Well, thank you, Dr. Swami, for taking care of so many people. I know I've had the opportunity to work with you and your staff, and just what good people they are. You walk in and they love on you, and they kind of fill
Yes.
your cup, and then you get to take care of us, mind, body, spirit, and really looking at the whole person. I think what's been so unique about our interaction in your practice is it's not just, diabetes, this is what you are. You really take the time to look at people, and it's because you've built your own business and your own practice to have the freedom to, like you said, spend time with people and create relationship and look at, Charity, she's crazy, she's 38, she's no time, but she doesn't sleep, and all this, being able to look at me holistically and say, okay, this is what we can do and how we can support and all of that. So thank you for seeing people truly, not just as like something to solve, but as a person, and for giving us just this wonderful wisdom today. What a blessing. And happy holidays to you and your family.
Yes. Thank you. Thank you. I love this time of the year.
It's going to be so good. So what I'm going to do is going to link your practice at the end of like all of the show notes so that people can get in touch with you. They can, let me celebrate you too. You also have this app called Healow, Healow. That's really easy. And I didn't get to tell you that, but it's really a wonderful interface with how I've been able to communicate with you in your office. So if you are I don't want to get on the phone with people, this is a wonderful tool that you've introduced to your practice. So I will share all of the information. We love you. We celebrate you. We're so grateful. Thank you, Dr. Swami, and have such a good day.
Thank you, Charity. Thank you, guys. Thank you. Bye.
Bye.